Pandemic, we've seen various shortages at stores. But as Ontario deals with a sixth wave of COVID cases and other seasonal ailments, there's another type of product that might be hard to find at your local pharmacy. Over-the-counter children's cold and flu medications. Take a stroll down the aisles of your local pharmacy. Chances are you'll see sites like this. Bare shelves, certain cold and flu meds out of stock. And it's not restricted to any one store or chain. City News visited several pharmacies in Toronto's East End. Each one had some stock missing. This Rexall pointing to manufacturer supply issues. We contacted the corporate offices for Shoppers and Rexall to ask about current supply levels. We didn't receive responses by our broadcast deadline.
There were several products that we would normally order in that are on a back order situation with our wholesalers.
Jen Belcher at the Ontario Pharmacists Association says the cause isn't fully known yet, adding current supply issues could be due to high demand or delays during the manufacturing process. However, she says one thing is clear.
We are seeing a bump in cases in people who have symptoms, whether it be of COVID-19 or influenza or just your common cold at this point in time in the year. We see, especially since March break and with some of the changes around public health measures, there's been an increase in the transmission of respiratory illness.
At Kid Crew Medical in Toronto, Dr. Dina Kulik says she and others are seeing and hearing about more sick children.
Certainly seeing a lot more viral illness, so kids with coughs, runny noses, vomiting, diarrhea, pink eye, sore throats, achiness, all, the whole gamut of viral symptoms.
In addition to consulting with a child's healthcare provider, she shares this advice for COVID or the flu.
Making sure they're hydrated, making sure they're comfortable with medicines like acetaminophen or ibuprofen, making sure they're getting lots of rest. Even if they don't have a great appetite, as long as they're drinking, they're interactive with you, they're not having struggles with breathing, they should be feeling much, much better in a couple of days.
So when can we see a return to a normal supply of those cold and flu meds for kids? Belcher says several products are scheduled to be back in stock as soon as May, but she says it's not uncommon for order dates to change. She urged parents not to substitute children's products for adult ones.
Those combination products, which are typically all the cough and cold products, it can be very difficult to dose adjust because they're in fixed ratios, and just reducing the amount doesn't often produce either therapeutic or safe amounts of medication for a child.
Kulik echoes that caution too.
For one, they're not very helpful, and in some cases can actually pose risk. So I wouldn't be reaching for these kind of cough suppressants or medicines like that anyway.
For more on this story, go to citynews.ca. In Toronto for City News, I'm Nick Westall.